Now, most strokes no longer have to produce devastating consequences if you act in time.
He made it to the hospital, I would say, in probably 25 minutes from when he left here, and 6 days later he walked out of the hospital. And I think that's a miracle. I really do.
The miracle is a new drug called TPA, for tissue plasminogen activator.
We've been able to develop a drug, TPA, which you can inject in a vein, goes through the body, but it knows where the clot is. It goes and locks onto that clot and dissolves it, and the blood starts flowing again.
But TPA only works if it's given within 3 hours of the onset of the stroke. For some patients who get to the emergency room after the 3-hour window, researchers are experimenting with a new device.
There's a device called the Mercy device that can actually retrieve clots. These clot retrieving devices can be threaded up into the brain, into arteries. Clots can be manually removed, and patients can often have good outcomes as a consequence of this.
83. We're almost there, Rick, okay, buddy?
Where you get treated is equally important. There are hospitals now that specialize in treating stroke. This patient is lucky. He's being taken to one of them, Alta Summit Medical Center. It's the only accredited primary stroke center in the Bay Area. Care begins en route.
Man over 60. Coming over. Are you able to squeeze my hands? Slurred speech. And his tongue drifts to the right.
The paramedics call in, and the stroke unit at the hospital goes into action.
Can you call neurology? We had a heart stroke, 70 years old, room 2.
Room 2? Okay.
Thank you.
A nurse then presses this special phone line, mobilizing an entire cadre of stroke specialists.
We have a 70-year-old hot stroke in room 2. Thank you.
Mr. Beeman, while Dr. Zellen is talking to you, I'm going to be starting an IV in this arm and getting a blood sample from you.
What's different is that we view stroke as trauma. So we're going to treat it just as if you were in an automobile accident, and we need to take care of you immediately.
I'm going to hold both hands up, and you tell me which hand is wiggling.
Dr. Zellen, CT is ready.
CT is ready? Okay, we're finished.
After the initial test to determine the extent of the stroke, a team of experts goes into action to stabilize him and assess the damage.
He requires minimal assistance to get from the bed to a wheelchair.
And for occupational therapy, it looks like he's getting only minimal assistance with things like bathing and dressing and grooming and hygiene tasks.
The purpose is to get the patient ready for the next phase of his treatment, rehabilitation.
And then on 3, you're going to stand up. 1, 2, 3. Very good. Okay. Good.
Can we get you
a little bit more on the right.
On that side?
Now step with the left.
Minoru Ishizawa is 85. He had a stroke while he was bowling.
What happened to me?
Yeah.
I don't know. Everybody said I passed out. Yeah, got a stroke. Yeah.
You were bowling?
I was bowling.
He had a bilateral stroke. So,
That's unusual.
yes, that's what the doctor said. They said, how did that happen? You're unusual in every case, Dan.
Mr. Ishizawa is a true American hero. During World War II, he was a member of the famous 442, the all-Japanese-American regiment highly decorated for its seemingly boundless courage. His stroke was severe, but his progress remarkable.
I'm amazed in a week how much he's come back. His right side's coming back.
Hold yourself, okay? Hold it. Good.
Rehabilitation works because the brain can actually rewire itself. And with repetitive training, brain cells can develop new connections, and people can regain the ability to use some of these functions that were lost because of the stroke.
You're right. Big step.
You know, memory, his memory was, for the past, was real good. But for future, since the stroke, it's kind of diminished.
Mr. Empleo's road back is much more difficult.
You can take a break if you want.
So somehow we have to get the hopeful message out that there is something you can do. It's not hopeless. And I think 4 or 5 years ago that was pretty much true. But now it's changed vastly. And the change is that now you can do something.
Okay. 30 cc. Okay.
How do you treat a stroke? Strokes require emergency treatment. Call 911 quickly. The newest drugs only work if you get to a hospital within a few hours. Recovery from a stroke continues for a lifetime. Strokes can be largely preventable